Time of year where it is open enrollment for many people, the time when employees can review their company's healthcare offerings, and it is also a good time to explore what employee assistance program services are available to family caregivers. Dr. Macie Smith, a gerontologist with Synergy HomeCare, is joining me live now to explain how EAPs support family caregivers. Good morning.
Good morning. Thank you for having me.
Thanks for joining me. So what are some of the biggest challenges that family caregivers face today, and therefore, how could an EAP help provide them with resources?
22% of the U.S. population is a caregiver, and they're also a part of the workforce. So they're a part of the sandwich generation.
Right.
Of that population, 73% say they are providing 20 to 30 hours a week of caregiving responsibilities, the baking, the cleaning, the helping with ADLs. And so what that leads to is that the average worker has a second job, and that second job is caregiving. It comes with physical responsibilities, but it also comes with an emotional toll as it relates to caregiving. And EAPs, employee assistance programs, they offer a free benefit to employees through their employers, but so many times employees don't know about the services and supports they offer. We typically see the medical, the dental, and the vision, but EAPs offer support with education and training. They also offer support with connecting to community resources such as counseling, also to connect with professional home care companies like Synergy HomeCare.
Yeah, I know one common one would be like an EAP will offer 4 to 6 sessions with a licensed therapist a couple, throughout the year. So that would be one thing that a caregiver would definitely need if they're pouring themselves into somebody else all of the time. But why would this be, what else could an EAP offer them?
So working with EAPs, you can also look into possible flexible working hours or remote working hours, because we know sometimes things happen and it's unexpected. And so being a caregiver, there are certain things that you cannot plan for, but then there are certain things that you can. EAPs also connect family members to long-term care supports, to geriatric care managers to help them bucket and compartmentalize the job responsibilities, both work life and also caregiving life, and to be able to help them navigate the long-term care system, because you don't know what you don't know until you figure out you don't know it. So having that geriatric care manager in place will help navigate that and help reduce a lot of the stressors that come along with a sandwich generation caregivers. And those EAPs, employee assistance programs, can connect employees to those services.
And you recommend something called care mapping. Can you explain what that is?
So care mapping is for caregivers to actually write down what they need assistance with, no matter how minuscule you think it is, to really write it down and to start compartmentalizing it. You would work with the EAPs on connecting you to resources such as if these elements fall into the mental health category or the need for emotional support, then the EAP will connect them with a therapist or a counselor. If this side, compartmentalized, identifies with the tangible support such as helping with activities of daily living, the dressing, the bathing, the household chores, then the EAPs will connect the employee to professional caregiving services or home care services. And so you want to just write down everything that you need assistance with or that you just don't know, and then the EAP will help that employee connect to those resources.
Since this is tied to our insurance, a lot of people feel hesitant to use it, like they're going to find out and then, find a way to, charge me for it later or something like that. What would you say to somebody who's hesitant to use these resources?
I would say you're already paying for it. As an employee, you want to take advantage of all the resources and support that is available. A lot of times we don't take advantage of it because we either don't know it exists or, as you stated, we're afraid to ask for it, but it is there. If you don't lose it, if you don't use it, somebody else is, or you might even lose it. So please take advantage of those resources that are available to you.
Yeah.
And it could cause harm on the back end in terms of putting your own job in jeopardy. And so those resources are there to help you to be a successful, healthy employee.
Yeah, we're leaving benefits on the table, and a lot of times these are benefits that the company has researched, and we've said these are things that we want from the company, and they give it to you, and then people are not using them like they should. So yeah.
Right. Employees do surveys to determine what the employees need. So you're exactly right about that.
Can you give us any success stories? Do you know anybody who's used an EAP benefit and found that it was very helpful?
So I'll tell you a story of the EAPs providing education and training on caring for adults living with dementia. The family didn't even know that it was a thing. The family didn't know that there was specialty practices that can help caregivers better understand how to provide care. And from that training and that webinar, they were able to connect with the geriatric care manager, with the AAA, with this area agency on aging, and had their loved one connected to Meals on Wheels and also an adult day center, so that way they could still go to work and ensure that their loved one was receiving the care that they needed. So it truly was a success story.
Yeah, and that's a good point to show that you can use it when you've got a family member who's depending on you too. Like a lot of people think, well, this family member has their own benefits, so we can't cash in on mine, but not really true.
No, and that's a good point, because Medicare, which a senior would have, does not pay for long-term services and supports. And so the caregiver would need to be connected to know what resources are available to take advantage of those. They're the liaison to help coordinate that care, and the EAPs are there to help with that process.
Yes, excellent point, Dr. Macie Smith. Thank you so much for joining me today. I appreciate your time.
Thank you for having me.